A dog walks into the ER, it's in critical condition and it can't even lift up its own head. It's infested with fleas and its gums are very pale and not pink at all, and it's just not in good condition. It's in critical condition and needs immediate care. As a veterinary assistant for the past 3 years in both general practice situations and emergency situations, I have seen the immediate effect of preventative medication on pets, and have also done extensive research for this speech. So as a pet owner, you have the option to prevent a more extensive need for medical care and also greatly reduce your pet's suffering and pain. And also, as a friend of pet owners as well, it's important to know if your friend's pets are on prevention, to make sure that you are not introducing fleas into your own home if your friend does bring their pet over to your house or into your car. So some people think that preventative pet medication is not necessary or that it is too expensive, but in reality, it actually helps to prevent much larger vet bills in the future, and also prevents life-threatening diseases and infections, and helps your animal's quality of life. So preventative care such as flea, tick, and heartworm treatment is a necessity for your pets. Today I will persuade you of the easiness of getting preventative medication, and then turn your attention to the detrimental consequences of not giving your pets preventative care, and reveal how giving preventative care will save you from larger vet bills and a lot of stress. So there are many options of preventative medications. As stated by CVM student Lauren Winensky in the article Factors Associated with Heartworm Prevention Use in the Golden Retriever Lifetime Study from June of 2023, the reported prevalence of preventative use in the United States is low, and some estimates fall around only 50% of dogs. Whenever you think of all of your friends that have dogs, that's a very low amount of people that actually have their pets on prevention. So there's topical treatments and oral treatments. These are typically your monthly ones that you give every month. You give them at the same time of month to make sure your pet is fully covered. And these are options such as Simparica Trio, HeartGuard, NexGard, and there's a few others. There are also injectable options for heartworms for sure. This is called ProHeart. It's an injectable heartworm medication that lasts 6 months sometimes, or 12 months. It helps if you don't want to have to remember to give your pet that prevention every month. So now that we have gone over the options for preventative care and the consequences of not using preventative care, or now we will go into the consequences of skipping preventative care. So using preventative medication prevents the consequences of this. So your heartworms, which are the top left picture, that's a model of a heart that is infected with heartworms. So these are, some people think that they actually are worms that come out of your pet's intestinal tract, but it actually clogs your dog's heart's arteries and affects their respiratory effort as well. So it causes coughing in dogs and just like their circulatory system not working properly. It's spread from mosquitoes, which we have a lot of here in Texas, down south, and how humid it is here. And then whenever you go into ticks and fleas, as stated by DVM Lauren Jones from the article The Complete Guide to Flea and Tick Prevention and the Treatment for Dogs from May of 2024, fleas and ticks can spread diseases such as Lyme disease, Rocky Mountain spotted fever, and infect your pet with tapeworms. So all of these things we see pretty commonly. As you can see there, that is my dog Dakota. She had fleas and ticks whenever I first picked her up off the street. You can see a little bald spot here. That is from her itching from the fleas biting her. She had an allergic reaction to that, and it caused her to have some bald spots. Luckily, whenever I got her started on preventative care, that cleared up pretty fast. So now that I've gone over the options for preventative care and the consequences of not using preventative care for your pets, I will now urge you to use preventative medication that benefits both you and your pets. So as stated by the ASPCA, which is a nationally recognized organization, in the article Cutting Pet Care Costs from 2021, the annual preventative cost can be around $400 for your annual visit, plus some prevention, and that also depends on your pet's size. So if your pet is a larger pet, then the prevention will cost a little bit more, but that includes your vaccines, your vet visit, and being able to communicate with your vet and get medications such as that. Your ER visit can be a very stressful and expensive visit. So where I work at Veg, just seeing a doctor can be $180 for the exam fee. That is without any treatment. That is a clouded leopard that had a blood transfusion because of the flea infection, and so super anemic, and it needed a blood transfusion, and it was upwards of $2,000 or more to be able to treat that. And then, as stated by the EPA, which is a government website, in the article Controlling Fleas and Ticks Around Your Home from June of 2025, the ways of removing fleas and ticks from your home is a very extensive and lengthy process. So just putting your pets on prevention and being able to know that your home is safe is a very reassuring feeling. That way you know that you aren't surrounded by little critters being in your home. So today I persuaded you of the ease of using preventative medications, and then I turned your attention to the detrimental consequences of not giving your pets preventative care, and then I urged you to give preventative care to save you from larger vet bills and a lot of stress. Preventative care is essential for protecting your pets. I ask you to call your vet today if your pet is not on prevention. Ask questions, make a plan. There are a lot of choices, and it only takes 5 minutes to change your pet's life and save you from a lot of financial stress and stress in general. Here are some vet clinics nearby. The first two are general practices. Veg is for emergencies only. So if anything was to ever happen, you can bring them there. And here are my references. Thanks for listening. Can you show everyone?